There were 7 tornadoes in an outbreak one evening here in Van Zandt County. Came through from south to north, damaged several hundred structures, lots of property, livestock. They ranged from an EF0 to an EF4, so there was quite a bit of damage across the county.
Lisette Osborne, who is a very active member of Texas Public Health Association, connected me with Russell Hopkins in Van Zandt County, and we discussed the tornadoes that occurred in April of 2017 and the fact that they wanted to rebuild that particular area with the social determinants of health in mind. And it wasn't much later that we were all meeting in Dallas to talk about what that partnership might look like. And as soon as we had that conversation with Russell, we decided that that was the project that we wanted to do. And so we got started pretty quickly on that. Part of the project was including a multidisciplinary task force. So we called in folks from the planning discipline as well as public health. So we have a task force that's been kind of directing all of our activities, but the main focus of this project has been on our student interns. We have several interns from 3 different disciplines across public health, social work, and planning. And so we've had 6 interns that have been working with us for the last several months, just trying to get this project off and running. And so we are here in Van Zandt County this week to roll out the toolkit that we've been working on to help rural communities plan for and to recover from disastrous events like tornadoes or floods or whatever the disaster may be.
This is the first in the country that we are aware of in creating a toolkit that a community can use for rural recovery efforts. Lots of resources in urban areas, not so much in rural areas. This is a first, and it's exciting.
Looking at the rural communities, we realized that there were a lot of problems which they faced in response to the disasters compared to the urban areas. And we noticed that with the poor resources which they had, there was a slow response, and also the rate of recovery would be slower compared to the urban areas.
Every disaster is a local disaster. Once it escalates to the point where resources are used up and then folks are reaching out to the county, they're reaching out to the state, and in certain instances reaching out to the federal government for assistance, then there are more things that come to bear. But when you're talking about a rural community and those resources that are available to that local community in a remote rural area, you may have an EMS system, ambulances, you may have 1 or 2 in a county. What if those 1 or 2 are taken out of play? Then where do those resources come from? How are you going to transport victims? How are you going to mobilize supplies?
The rural communities, they lack the resources, and they lack a kind of plan to address disasters. So what we did was to address this in terms of planning, response, and recovery. So the toolkit needs to be had beforehand. They need to understand the materials in the toolkit before the disasters occur, and they also need to understand what resources are available to them whenever these disasters occur.
We are writing this toolkit based on the social determinants of health perspective. And by this we mean the conditions in which the people live in which they were born in which they grow in which they learn, and in which they will age. And this helps us because we'll be able to write something that the people could relate to, not just something abstract that wouldn't matter to them. So by doing this, we first came to Canton, to Van Zandt County, and met with the residents of the community and interviewed them and got information we needed from them. And by getting this information, we will write a toolkit and we'll develop something that will directly relate to them.
We looked at the immediate needs assessment. We looked at the finance and how they could gather resources towards getting a quick response and also to address the recovery. We tried to get a recovery measurement tool which they can use to assess their level of recovery. And we also looked at animal care being a very vital part of the communities.
The toolkit will be disseminated in the first quarter of 2018. It will be available free of charge on the Texas Public Health Association website, on the American Planning Association Texas chapter website, and on the Planners for Health website.